My name is Clayton, and 6 months ago I thought the worst thing about my demanding job as an architect was the long hours and difficult clients. I spent most of my days hunched over drafting tables and computer screens, designing commercial buildings for a firm in downtown Portland that specialized in sustainable construction. It was rewarding work that I was passionate about, but it was also physically demanding in ways I hadn't anticipated when I chose architecture as a career. After 3 years of poor posture, stress, and minimal attention to my physical well-being, my body finally decided to stage a rebellion. I woke up one Tuesday morning with such severe lower back pain that I could barely get out of bed, and by Thursday, the pain had spread to my neck and shoulders, making it difficult to concentrate on work or sleep comfortably. "Clayton, you look terrible," said my colleague Sarah as I grimaced while trying to adjust my position at my workstation. "When's the last time you took care of your body, instead of just pushing through the pain?" "I don't have time for taking care of my body. The Morrison project is due next week, and I'm behind on the structural drawings. You're not going to be able to finish any project if you can't sit at your computer without wincing. Have you considered seeing someone about that back pain? Like a doctor?" "I don't think it's serious enough for medical intervention." "Not a doctor. A massage therapist. Someone who specializes in treating work-related muscle tension and postural problems." The suggestion seemed reasonable, though I'd never considered massage therapy as a solution to my physical discomfort. I'd always thought of massage as a luxury spa service rather than legitimate healthcare. "Do you know anyone good?" "Actually, yes. There's a place called Restoration Wellness about 10 minutes from here. Jesse Matthews is supposed to be excellent with chronic pain and postural issues. I can give you his contact information." That evening, desperate for relief from pain that was making both work and sleep difficult, I called Restoration Wellness and scheduled an appointment with Jesse Matthews for the following Friday afternoon. "Mr. Clayton," said the receptionist when I called, "Jesse has an opening at 2 p.m. on Friday. This will be your first appointment with him, so please, plan to arrive 15 minutes early for intake paperwork." "What should I expect from the session?" "Jesse specializes in therapeutic massage for chronic pain and workplace injuries. He'll do an assessment of your specific issues and develop a treatment plan that addresses your individual needs." "How long are the sessions?" "Initial appointments are 90 minutes, which includes consultation time and the actual massage therapy. Follow-up sessions are typically 60 or 90 minutes, depending on your treatment needs."
Friday afternoon, I left work early and drove to Restoration Wellness, a small clinic in a converted house in the Pearl District that felt more like a health center than a spa. The atmosphere was professional and calming, with soft lighting, instrumental music, and the kind of therapeutic environment that immediately made me feel like I was in capable hands.
"Clayton?"
A man emerged from one of the treatment rooms and approached the reception area.
"I'm Jesse Matthews. Thank you for choosing our clinic."
Jesse was not what I'd expected from a massage therapist. He was probably in his early 30s, tall and athletic, with the kind of build that suggested he maintained his own physical fitness as seriously as he helped others with theirs. He had dark blonde hair, warm brown eyes, and a professional demeanor that was friendly without being overly familiar. "Nice to meet you, Jesse. I have to admit I've never done this before."
"No problem. First-time clients are common, and I'll explain everything as we go. Let's start by talking about what brought you here today."
Jesse led me to his treatment room, which was spacious and well-equipped with a professional massage table, various therapeutic tools, and anatomical charts that suggested serious medical knowledge rather than just relaxation services. "So tell me about your pain. When did it start? Where is it located? And what activities make it better or worse?"
I described my work setup, the gradual onset of back and neck pain, and the way my discomfort had escalated over the past week to the point where it was affecting my ability to function normally. That sounds like classic postural dysfunction, combined with muscle tension from stress and repetitive motion, very common in people who spend long hours at computers or drafting tables.
Is it something that can be fixed, or am I just going to have to live with chronic pain?
It's definitely fixable, but it requires a combination of therapeutic treatment and lifestyle changes. The massage therapy can address the immediate muscle tension and pain, but we'll also need to work on postural habits and exercises to prevent the problem from recurring.
Jesse's assessment was thorough and professional. He asked detailed questions about my work environment, exercise habits, stress levels, and medical history. He also conducted a postural evaluation that involved observing how I stood, sat, and moved.
Clayton, I can see significant tension in your upper trapezius muscles, tightness in your hip flexors, and what appears to be forward head posture. That's putting strain on your cervical spine. That sounds bad. It's correctable, but it's going to require consistent treatment and some changes to your daily routine. Are you willing to commit to a treatment plan that might involve several sessions over the next few weeks? If it means getting rid of this pain, absolutely. Good. Let's start with the massage therapy, and I'll explain what I'm doing as we proceed so you understand how the treatment works. Jesse stepped out of the room while I undressed and positioned myself on the massage table, covered by a sheet, as he'd instructed. When he returned, he began with gentle techniques designed to help me relax and become comfortable with therapeutic touch. I'm going to start with some broad strokes to warm up the muscle tissue, then focus on specific areas of tension. Let me know if the pressure is too light or too firm. Jesse's hands were warm and professionally confident. As he began working on my back and shoulders, his touch was clearly therapeutic, rather than relaxation-focused, with techniques that seemed designed to address specific problems, rather than just provide general stress relief. You have significant knots in your rhomboid muscles, Jesse explained, as he worked on my upper back. These are usually caused by prolonged hunching over a desk or computer. Is that what's causing the pain? Partly. When these muscles are tight, they pull on other muscle groups and can affect your whole postural chain. We need to release the tension here, and then address the underlying postural habits that created the problem. As Jesse continued working, I found myself relaxing in ways I hadn't experienced in months. The combination of professional expertise and genuine concern for my well-being made the treatment feel like serious healthcare rather than just a luxury service. How does that pressure feel? Jesse asked, as he used deeper techniques on particularly tight areas. Intense, but good. Like you're actually addressing the problem, instead of just temporarily masking it. That's exactly what we're doing. Therapeutic massage is about treating the underlying issues, not just providing temporary relief. Jesse's approach was methodical and thorough. He worked systematically through different muscle groups, explaining what he was finding and how it related to my overall pain pattern. His knowledge of anatomy and physiology was impressive, and he clearly understood how different areas of the body affected each other. Clayton, I'm going to work on your neck now. This area is particularly sensitive, so I want you to tell me immediately if anything feels uncomfortable or painful. When Jesse began working on my neck and shoulders, his touch became even more careful and precise. He had strong hands that seemed to know exactly where the tension was located and how much pressure to apply to release it without causing discomfort. You have significant tension in your suboccipital muscles, Jesse said as he worked on the base of my skull. These are often tight in people with forward head posture. Is that why I've been getting headaches? Very likely. When these muscles are tight, they can cause referred pain that feels like tension headaches. As Jesse continued working on my neck, I became aware of how close he was, how focused and attentive his treatment was, and how much better my body was already beginning to feel. There was something about his professional competence, combined with genuine care, that made me feel completely safe and well cared for. "How are you feeling so far?" Jesse asked as he moved to work on my lower back. "Much better already. I can feel the tension releasing in areas that have been tight for months." "Good. That's what we want to achieve." "Clayton, your muscle tension is significant but definitely treatable. With consistent therapy and some postural corrections, we should be able to resolve these issues." "How many sessions do you think I'll need?" "Probably 6 to 8 sessions over the next month. Then periodic maintenance as needed. But it also depends on whether you're willing to make some changes to your work environment and daily habits." "Whatever it takes. I can't continue living with this level of pain." Jesse's treatment continued for the full 90 minutes, addressing not just my immediate pain, but also areas of tension that I hadn't even realized were problematic. By the time he finished, I felt like a completely different person, relaxed, pain-free, and more physically comfortable than I'd been in months. "How do you feel?" Jesse asked as I slowly sat up on the massage table. "Incredible. I had no idea how much tension I was carrying until it was gone." That's a common reaction after the first therapeutic session. Your body is going to feel different for the next day or two as it adjusts to the new muscle length and positioning. Different how? You might feel a little sore tomorrow, similar to how you feel after exercise. That's normal, and indicates that we've made significant changes to your muscle tension patterns. Jesse provided me with a detailed sheet of postural exercises and workplace ergonomic recommendations, along with suggestions for maintaining the progress we'd made during the session. "Clayton, I want to schedule you for another appointment next week. Consistency is important when we're addressing chronic issues." "Absolutely. Jesse, this was incredible. I feel like I have my body back. I'm glad the treatment was effective. With continued sessions and some attention to the underlying causes, we should be able to resolve your pain issues completely." I scheduled a follow-up appointment for the following week and left Restoration Wellness feeling better than I had in months. Jesse's treatment had been professional, effective, and exactly what I'd needed to address my physical problems. But I found myself thinking about more than just the therapeutic benefits of the massage. Jesse's professional competence, his genuine concern for my well-being, and his careful attention to my comfort had impressed me in ways that went beyond simple appreciation for good health care. My second appointment the following Friday went even better than the first. Jesse had clearly reviewed his notes from our previous session and focused on areas that needed additional work, while building on the progress we'd already made. "Your posture is already noticeably improved," Jesse observed as he conducted a brief assessment before beginning the massage. "Have you been doing the exercises I recommended?" "Every day. Plus, I adjusted my workstation based on your ergonomic suggestions. It shows. The tension in your upper trapezius is significantly reduced compared to last week." As Jesse worked on areas that were still tight, we talked about my job, his background in massage therapy, and our mutual interests in health and fitness. "What made you choose massage therapy as a career?" I asked, as Jesse worked on releasing tension in my hip flexors. "I was actually a personal trainer first, but I kept seeing clients with injuries and chronic pain that exercise alone couldn't address. Massage therapy seemed like a natural extension of helping people with their physical well-being. Do you enjoy the work? I love it. Being able to provide immediate relief for people who are in pain, helping them understand their bodies better, seeing them regain function and comfort. It's incredibly rewarding. You're clearly very good at it. Jesse, this is the first time in months that I've felt normal. That's exactly what we want to achieve. Clayton, how's your pain level between sessions? Are you maintaining the improvements, or does the tension return quickly?
Much better than before treatment, but I can feel some areas starting to tighten up again by midweek.
That's normal in the early stages of treatment. As we continue working together, you should be able to maintain the improvements for longer periods. Jesse's treatment during the second session was even more targeted and effective than the first. He seemed to have developed a comprehensive understanding of my specific issues and was methodically addressing each area of dysfunction. Clayton, I want to work on your neck again today. You're still carrying significant tension in your cervical muscles. When Jesse began working on my neck, his touch was again careful and precise, but I found myself being aware of more than just the therapeutic benefits. There was something about his focused attention, his gentle but confident touch, and his obvious expertise that I found increasingly attractive. How's the pressure? Jesse asked as he worked on particularly tight areas at the base of my skull. Perfect. Jesse, you have incredible hands. Thank you. I've been doing this for 6 years, so I've had plenty of practice. As the session continued, I realized that my appreciation for Jesse's professional skills was developing into something more personal. He was attractive, intelligent, clearly passionate about his work, and had a gentle confidence that I found appealing beyond just the therapeutic context. Jesse, I said as he finished the treatment, can I ask you something personal? Sure. Do you ever socialize with clients outside of the clinic? I mean, is that something that's professionally appropriate? Jesse paused in cleaning up his equipment and looked at me with what seemed like surprise and interest. It's not something I typically do, but it's not prohibited by professional guidelines, as long as the therapeutic relationship is maintained appropriately. The reason I ask is that I'd like to take you to dinner sometime, as a way of thanking you for the incredible work you've done. These sessions have completely changed my quality of life. Clayton, that's very kind of you to offer. Is that something you'd be interested in? Jesse was quiet for a moment, and I could see him considering both the professional and personal implications of my invitation. I'd like that, he said finally. But I want to be clear that it wouldn't affect our professional relationship or the continuation of your treatment. Of course not. I'm asking because I'd like to get to know you better as a person, not because I want to complicate the therapeutic work we're doing. Pleased. In that case, yes, I'd enjoy having dinner with you. We made plans to meet at a restaurant in the Pearl District the following Tuesday evening, and I left the clinic feeling excited about the prospect of spending time with Jesse outside of the professional setting. Our dinner was everything I'd hoped it would be. Jesse was intelligent and engaging, with interests that ranged from outdoor activities to travel to his ongoing education in various therapeutic modalities. He was also genuinely funny, with a dry sense of humor that perfectly complemented his professional competence. Thoughtful. Jesse, I said as we shared dessert, I have to admit something. Curious. What's that? Hesitant. I was nervous about asking you to dinner. I wasn't sure if you'd be interested or if it would be appropriate. Surprised. Why were you nervous? Explaining. Because you're clearly successful and accomplished, and I'm just a client who needed help with back pain. I wasn't sure you'd see me as anything more than a professional obligation. Jesse smiled, and I could see warmth and genuine interest in his expression. Reassuring. Clayton, you're intelligent, successful, thoughtful, and genuinely appreciative of the work I do. Why wouldn't I be interested in getting to know you better? Chuckles. When you put it that way, it sounds reasonable, firmly. It is reasonable, confiding. And Clayton, I have to admit that I've been looking forward to our sessions more than is probably typical for a purely professional relationship. Surprised, really? Sincerely. Really? You're an engaging person to work with, you're committed to your treatment plan, and you ask thoughtful questions about the therapeutic process. You're exactly the kind of client who makes this work rewarding. A little disappointed, just as a client? Warmly. Not just as a client, as a person I'd like to spend more time with. Over the following weeks, Jesse and I continued our therapeutic sessions while also developing a personal relationship outside the clinic. We had dinner regularly, went hiking together on weekends, and discovered that we had compatible interests and values that made spending time together genuinely enjoyable. Serious. Clayton, Jesse said one evening as we cooked dinner together in my apartment, I need to ask you something. Openly. What's on your mind? Concerned. How do you feel about the fact that our relationship started in a professional therapeutic context? Does that feel strange or inappropriate to you? Reassuring. Not at all. Jesse. You provided exactly the healthcare I needed when I was in significant pain. The fact that we developed thoughtful. None. You maintained complete professionalism during all our sessions. You never made me feel uncomfortable, and our personal relationship developed separately from the therapeutic work. Relieved. Good. I've been thinking about that, making sure that everything about our relationship has been appropriate and ethical. Sincerely. Jesse, what we have feels completely natural and right to me. The professional competence that attracted me to you as a therapist is the same competence that attracts me to you as a person. Warmly. Same here. Clayton, working with you, helping you resolve your pain issues, it reminded me why I love this profession. And getting to know you as a person has been one of the best parts of this year. 6 months later, Jesse and I had settled into a relationship that felt both passionate and stable. My back pain was completely resolved, though I continued seeing Jesse monthly for maintenance sessions that kept me feeling physically comfortable and healthy. Playfully. Any regrets about asking your massage therapist to dinner? Jesse asked one evening as we planned a weekend hiking trip together. Amused. About mixing professional healthcare with personal relationships, about falling for someone who's seen me at my most physically uncomfortable, about completely changing my understanding of therapeutic touch. Teasing. Any of it, all of it. I looked at Jesse across our shared living space. We'd moved in together 3 months earlier, and marveled at how completely my life had improved since that first appointment at Restoration Wellness. Softly. None. Sincerely, I said, honestly. Jesse, you didn't just fix my back pain. You introduced me to a completely different understanding of health, wellness, and what it means to take care of my body. Warmly. And you introduced me to someone who appreciates what I do professionally, while also seeing me as a complete person outside of work. Happily. Best healthcare decision I ever made. Happily. Best client I ever treated. As Jesse pulled me close for a kiss that tasted like home and healing, I reflected on how dramatically my life had changed since I'd finally decided to address my physical pain professionally. What had started as a desperate attempt to resolve chronic discomfort had become the foundation for the most meaningful relationship of my adult life. Sometimes the best healing happens when someone cares enough to treat, not just your symptoms, but your whole well-being. Sometimes the most therapeutic touch is the one that opens your heart as well as relaxing your muscles.